Hi, I'm Dr. Paul Ruff at West End Plastic Surgery, and I'm here with Dr. Lexie Wang, our facial plastic surgeon, and we're going to have a little chat about facelifting because I think it's something that many people think about. We all see our aging in different ways at different times, and there's many approaches to this. So how do you approach just facial aging in general when you're talking to, when a patient comes to say, I don't like, I don't like this, but they can't really describe exactly what they don't like?
Well, I think a lot of it is trying to figure out, again, what are they bothered by, but there is a lot of education too with facial aging. Facial aging comes in many different forms along the way. There's the skin, there's the fat underneath, there's the muscles, the fascia, all that other, the skin, everything like that. So we have to figure out what layer exactly are they going to, or what layer are they seeing their problems at? What can be addressed non-surgically versus surgically, and then figuring out what we can do as a whole to get them their desired outcome.
Yeah, it is a complex set of structures and it's multi-dimensional,
yes.
Which does make it a little bit difficult from an education and then a decision tree standpoint because holy cow, there's so much.
Yeah.
So when we're talking about the more surgical approaches to facial aging, you'll see a lot about short scar facelifts, deep plane facelifts, SMAS facelifts. Like it is difficult when patients come in with a very specific idea in mind. Tell me a little bit about how you address that in your personal approach.
Sure. So first, addressing the scars, it would be very dependent on, again, what level of the face they are noticing they're aging at. I think if people are primarily focused on the jowl and around the jawline, that can be treated with a shorter scar facelift. But if they're really worried about marionette lines and getting a little bit higher on the face, we do have to talk about just doing a full facelift. And then in terms of going over the different techniques and the different styles, as you said, there are a bunch of different styles of doing it. I think the style that I was trained primarily in was to do the deep plane style and technique. And largely people enjoy that because it tends to give both a combination of a bigger lift, but at the same time it's more sustained and almost looks more natural because you're just playing with the tissue that someone already has. You're not really changing anything, you're just kind of lifting it all back up and keeping everything that's still connected where it should be, so that way it doesn't look like someone's pulled or fake.
Yeah, I do all of them. I've been trained in all of them.
Yeah.
I would say I have probably migrated more to the deep plane at this stage. But there are times when I'll even do asymmetric techniques depending on the variable issues one side of the face to the other, because some preserve a little bit more, some take away a little bit more, and it does give you a little bit more control of all of that.
Yeah.
Fantastic. So full face comprehensive rejuvenation or more focused? How do you fall on that spectrum?
I think, again, that kind of falls back to what the patient is looking for. If someone comes in and says, I just want help, I would talk to them about all their different options. However, there are definitely some patients who might be a little bit scared or a little bit more cautious about what they want to do, and they don't feel ready to do everything or to undergo such a big change. So for those patients, we can definitely talk about, well, where can we get the best bang for what you're looking for? So maybe I look at them and I say, I think if we really just focus on your eyes, we can do that for a few years and then come back and visit the neck later or something like that. But that way, we can have a dialogue again about what matters to them. I can give them my recommendations, but at the end of the day, I want them to be happy. So if they are not ready to make the full leap, let's just focus on their eyes then.
Yeah, I would agree. I mean, there are times when being able to treat something that is more obvious and bring it into alignment. But there are times when you look at the entire face and patients come in with, I just want my jowls taken care of, but you look at their eyes and they have big bags or they have a lot of sagging areas or the texture of their skin looks terrible. And by rejuvenating this, you're going to place it way out of context of everything else. And I think that's probably the one thing that I hear about the most is everybody's like, I just don't want it to look obvious.
Yeah.
And I think you made a great analogy in just a minute ago when we were talking, and so I'll have you share that analogy. But I think sometimes doing everything honestly looks less obvious than doing something that brings it out of alignment with the rest of the face.
Yes.
So yeah, share your, I thought it was a great analogy.
I got this from my mentor, but he basically said it's kind of like redoing a hotel. You don't want to just redo the lobby and then have people go upstairs and say, what is going on with my room? The room still is multiple decades old. You know, you want to redo everything so that way the whole hotel looks redone. So I totally agree. I think when you do focus on just one area, sometimes it does highlight how much more aged another area might appear. And it does make someone look like, oh, they've clearly had surgery done. But if you want to just kind of make everyone look refreshed and relaxed overall in general, then you kind of do have to sometimes do a little bit more.
Yeah, I would agree. All right, Dr. Lexie Wang, thank you so much.
Thank you.
Please make an appointment to see her. She's fantastic.